Hi, good afternoon. It looks like most people who were in the waiting room are now joining us. So I think we can get started. Welcome. Thank you for joining. My name is Lisa Berard, and I'm the director of the Care Compass Open Network Services. And the purpose of our meeting today is to review the enhanced health-related social needs services that are allowable within the 1115 waiver. Because at first glance, the service array looks like it's very broad and probably well provided within our community. But when you look more closely at the specifics of the services, there may be some areas that we don't currently have sufficient capacity, and we'll need to encourage organizations to develop those services or to enhance services that they are currently providing. And then secondly, as Care Compass Network prepares to apply as the lead entity for the social care network, there will be some supports that we would very much appreciate being provided from our member organizations. So we'll get right to it. Amira, next slide, please. Thank you. So just to level set, the service levels, there are two within the waiver, and level one includes the screening of Medicaid members to determine the existence of health-related social needs. I know a lot of organizations are currently doing screenings of individuals, but for the purposes of the waiver, they have identified a very specific tool that must be utilized for reimbursement. Level one includes case management, which is navigation basically to our existing programs and services in the community. It includes members that are in fee-for-service or managed care, but not necessarily those that meet the criteria for the higher risk target populations. So for those individuals, it's basically business as usual, referring to all of our existing services that do have existing payment streams in the present. Next slide. Level two service domains. So they're very broad. Am I cutting out? No? Okay. They're very broad. They include case management, housing, nutrition, and transportation. But when you get right into the specifics, they are very time specific, time limited, and for a very specific Medicaid managed care individuals who are identified as high risk populations. And we'll take a quick look at what those populations are. Next slide. So obviously high utilizers, and that's defined by their inpatient utilization, ED utilization, or total Medicaid spend. Individuals enrolled in health homes or with SUD or SMI, individuals with intellectual and developmental disabilities, pregnant persons up to 12 months postpartum, the criminal justice involved population post-released with serious chronic conditions, the juvenile justice involved youth, foster care youth, and youth under kinship care, all children under the age of 6 or children under the age of 18 with one or more chronic conditions. Now, also, to receive the health-related social needs services, individuals must have a documented medical need for the service, and the service identified must be determined to be medically appropriate. And we recently received some information that in our currently defined 6-county Southern Tier region, we have approximately 63,500 individuals who are eligible to receive the enhanced HRSN services. Next slide. So the allowable services will be delivered by social care providers that are members of the social care network. They obviously, as we stated, they must be clinically appropriate and have a reasonable expectation of improving or maintaining the health of the individual. Now, we still have yet to receive the New York State Social Care Network Program Manual, and that may very well stipulate additional guidance and implementation standards to what we currently know today. And we'll get into the services that have been specified as we know them currently. And these can be found in the MRT demonstration document if you're curious. Next slide. So first, case management in level 2. This includes referrals to the enhanced services, outreach and education, including linking to other state and federal benefit programs. So not only to the HRSN services, but any benefits and programs that are reasonable for the individual. Assistance in program applications and those associated fees, connection to providers, crisis services, behavioral health services, and MCOs, employment education, childcare, interpersonal violence, and legal assistance resources, and then beginning that closed loop process to follow up on those referrals and connections to ensure that they have been successfully delivered and identify any additional referrals and connections that may be required. Next slide. So for housing supports, we had some of these services during the DSRIP days. Medically necessary air conditioners, humidifiers, air filtration, asthma remediation, basically anything that makes the home environment more appropriate for medical treatment and the health and well-being of the individual. Home modifications that are medically necessary, ramps, grab bars, improvement to ventilation systems, but also mold and pest remediation. A rent and temporary housing service that can include utility costs for up to 6 months of the demonstration period. And this is limited very specifically to individuals transitioning out of institutional or congregate care settings, individuals who are also deemed to be homeless, high Medicaid utilizers who are homeless, and youth who are transitioning out of the child welfare system, and that is inclusive of foster care. Pre-tenancy and tenancy sustaining services. So pre-tenancy services are anything that assists the individual in the progression of applying for the home, researching prospective housing options, searching for the availability of rental assistance, just getting the individual through that whole search and application process. Tenancy sustaining services, which include rights, education and eviction prevention. So linking to free or affordable legal services specific to housing related issues, connecting them to services that would help them in establishing a bank account and establishing bill paying processes. Social services to obtain sources of income necessary for community living, also to help establish credit and understanding the obligations of tenancy. Addressing any circumstances that may jeopardize their housing, and that can include direct interventions or, again, connection to other community resources, and assistance resolving disputes with either neighbors or landlords that might create the risk for eviction, and assistance with the housing recertification process. Housing transition navigation services. So a one-time transition and moving costs can be covered, which would include their first month's rent and security deposit, relocation expenses, the activation of their utilities, any pest eradication that may be necessary, pantry stocking, household goods and furniture, which are services that we'll get to in just a moment. Assistance in setting up the new unit to address the needs that are identified in a person-centered plan, home modifications, and supporting all the details required in a move. I personally hate moving. I don't know anyone who enjoys it. There's a lot to manage, so plenty of room for assistance there. Connection to resources aiding with housing costs, and providing a review of the living environment. So going in and ensuring that that environment does meet the clinical and medical needs and is ready for move-in. And for those individuals transitioning out of institutional facilities, to collaborate with staff from those facilities to ensure a seamless transition to the community residents. This is a challenging service: recuperative care and short-term pre-procedure and post-hospitalization housing. So these are settings intended to provide a safe and stable place for individuals transitioning out of institutions who are likely at risk of incurring hospitalizations or ED visits. The treatment is intended to be short-term. The pre-procedure housing is for individuals who are scheduled for surgery and may need some additional supports for preparation or pre-surgical care. Those supports must be provided by a medical professional. This service is intended for individuals experiencing homelessness and transitioning out of institutions. The eligible settings must have appropriate clinicians who can provide medical and/or behavioral care, and the facility cannot be used primarily for room and board without those additional recuperative support services. So a couple challenges there is capacity, where can these services be set up, and then the medical staffing for those services. Moving on to nutrition supports. So nutrition counseling and education, including meal planning in connection with budget resources for groceries. Delivered meals, up to 3 prepared meals may be delivered for a limited time of 6 months. The individuals must have a health or medical condition that will benefit from medically tailored meals. The meals must be approved by a registered dietitian nutritionist. For individuals who are high risk pregnant, they may receive the service for up to 11 months as opposed to the 6-month stipulation, but not to exceed 2 months postpartum. And individuals receiving this service may not receive either of the next 2 services, which are pantry stocking or nutrition prescriptions. So medically tailored or nutritionally appropriate food prescriptions, food and vegetable prescriptions and protein boxes. These can be received for up to 6 months. They can be provided in a variety of forms. They can be delivered in food boxes or they can be vouchers. Again, high-risk pregnant individuals do have an extended time to receive the service of up to 11 months, not to exceed 2 months postpartum. And those receiving this service may not get delivered meals or the pantry stocking, which is the next service. Pantry stocking of fresh produce and non-perishable groceries for up to 6 months. This is limited to pregnant persons and children. High-risk pregnant individuals can receive the service up to 11 months. And individuals who receive this service cannot receive either of the other 2 services. So all of those services had a 6-month limited duration. However, they can be renewed for additional 6-month periods if a follow-up assessment does determine that the clinical criteria needs are still being met. Also, another deliverable service is providing cooking supplies that are necessary for meal preparation, such as pots, pans, utensils, even microwaves and refrigerators. Although in another area, it does say the refrigerators must be for medical needs, but they may be provided when they're not available through other existing programs or resources. And then transportation. This is the simplest. Basically, any transportation will be reimbursed, that it can be public or private, that connects individuals with the HRSN services or the case management activities that have been covered. So as previously mentioned, Care Compass Network is applying to be the social care network lead entity, and this role is responsible for coordinating the HRSN service delivery among the social care network of providers. The application is due on March 27th. The state highly recommends preceding that date by at least 4 days. Care Compass Network intends to submit no later than 3/22, which is a Friday. And to meet certain requirements of the application, we will be seeking input from community organizations. Next slide, Amira. So the information that we'll be looking for. As your organization reviews the list of allowable services, which of those do you currently provide? Which of the services that you don't currently provide would your organization consider developing? We're going to ask that you estimate the need for financial resources that would support the expansion of services or the startup of new services, and to estimate your organization's capacity for delivering those services. referencing back to over 63,000 people are qualified for these services. Next slide, please. So our next steps. A survey is in development. It will be distributed to all of our current participating organizations, along with any organizations that have expressed an interest to be involved, and those in the newly added regional area, which is the County of Otsego. The timeliness of responses really is critical because we're on a very tight timeline to get that application completed. It will initially be sent to the executive leadership of each organization to distribute as they see fit. And a point person for future communications can be identified as part of the survey. And also the next step, there will be a stakeholder meeting Thursday, February 15th to review the responses to the submitted questions. So those are questions submitted both to Care Compass Network and to New York State. New York State says they intend to provide their responses by this Friday, the 9th, and also to review the IT infrastructure overview for the 1115 requirements. And I saw a couple of chats, and please, if there are any questions, feel free to speak up. What does participate? So Alexis, that would be members of the Open Network or members of the IPA would be our participating member organizations. But also if there are additional organizations who have not yet joined either one of those networks and are interested in being involved in the waiver, we would include them in the survey as well and work to onboard them with one of the networks. Sure, we're happy to share the slides. Alexa, your organization is already part of the Open Network, so you'll be surveyed automatically. We intend to continue working with those counties. The exact pathway for that to happen has not yet been developed, but we do have DSRIP funds remaining, and we will continue to invest in those regions with those monies as well. Lenore, the fee schedule has not been released as yet. We do know that the lead entity will be receiving the PMPM from the MCO. The state will define what the fee schedule is, and the organizations will be paid through the social care network, the SCN lead entity, I should say. Are there any questions or concerns over the service delivery, the services that are approved? Hi, Sally. Nice to see you.
You as well. Is this the same survey that I already filled out with you, Amira? No, another one. Okay.
Yeah, that was the traditional annual survey that you already received. The survey being developed now is very specific to information that's required in preparation for the lead entity application, and also in preparation for, you know, where do we need to further develop the network? What is the current landscape for services that exist right now? I think for OPWDD, you would be a referral agent and recipient of referrals for individuals who are not yet connected with those services. The way I'm reading the waiver right now, it looks very similar to how the CCOs are structured. So I think it will be a cooperative, collaborative approach to delivering services for that specific subset of population. And there is reference to person-centered planning, which for those who have worked with OPWDD, that is at the core of their service model. It would likely be at the noon hour. Again, it seems to be easier for people to work into their day. The question for those who may not have seen it is, have we set a time for the meeting on the 15th? So the noon hour seems to work well for people. Feel free to eat your lunches while we chat. Did we get everything in the chat box?
Yes.
Okay, we'll get these slides out to all of you. If any questions crop up later, please feel free to reach out to myself or anyone on the Open Network team, Amira, Alexa, Georgia. Oh, another message. Oh, thank you, Chad. I appreciate it. All right, well, thank you all for joining us today. Enjoy the rest of your lunch hour, and we will see you soon.
Thank you.
Bye-bye.
Thank you.